You may have heard a lot of questions about the readings on your glucose meter, but don't worry. Let's take a look at the meanings behind the numbers and we can discuss what glucose goals are right for you. First, let's go over some definitions to help you better understand the timing of different types of measurements. Fasting glucose refers to 8 or more hours without food or drink. Pre-meal glucose is usually taken before your first bite of food and mealtime medications. Your post-meal or after-meal glucose is defined as 1.5 to 2.5 hours after the first bite of a meal. Bedtime glucose is more similar to pre-meal or post-meal glucose, depending on your eating and sleeping schedule. Depending on what time you're checking, the glucose you should aim for will also change. For type 1 and type 2 diabetes, the goal for fasting and pre-meal glucose is between 70 and 130 milligrams per deciliter. And the post-meal glucose goal is 100 to 180. For patients with pre-diabetes, there are no standard glucose goals. So I encourage my patients who are looking to lower their diabetes risk to keep their glucose under around 100 at fasting or pre-meal and below 130 after a meal. Your hemoglobin A1C, another glucose indicator done in the lab, is another nice way to check your glucose stability over time. Now, your A1C levels reflect the average glucose over around 3 months. That's the approximate life of your red blood cells. It's a useful tool to get a snapshot or average of your glucose, but it's not going to tell you any details about your level of control. I'll talk more about how to fix that shortcoming a little bit later. But generally speaking, if your A1C is between 5.7 to 6.4%, that's basically a diagnosis of pre-diabetes. When your A1C gets above 6.5%, the diagnosis changes to diabetes. So how often do you need to test this A1C? Well, if you're stable and meeting your goals, it's recommended to check A1C around every 6 months. If you're not meeting your treatment goals, or you've changed medications, your eating patterns, or your lifestyle, you should check your A1C more often until it's stable. Basically, every 3 months. Now, back to that point I mentioned earlier, the A1C gives us an average, it doesn't give us the whole picture. Plenty of research shows that big swings in blood sugar, from high to low or low to high, tend to lead to higher risks of diabetes complications and higher risks of low glucose. So while you still need to get your A1C tested in the lab regularly, you should still check your glucose at home often to know your peaks and your valleys. The home readings combined with A1C give your doctor a more complete picture of your glucose and a better feeling of your risks overall. So what's the right A1C target for you? It depends on many factors. How long you've had diabetes, your age, any underlying heart disease or diabetes complications, hypoglycemia unawareness, which is when a person doesn't have any symptoms or signs of a low blood sugar, and also other conditions or individual considerations. So talk to your doctor and ask our diabetes educators to know what glucose and A1C goals to aim for. I hope this video helps you to better understand your blood glucose numbers. So keep checking your glucose routinely and try to stay stable in your target range that's right for you.
I hope you liked this video. Go ahead and scroll through our website or our Unified Care app for more information about chronic conditions, vitals monitoring, and general nutrition and wellness. See you again soon.